Hello, my name is Peggy Roberge, and I worked in the VA system for 28 plus years as a registered nurse, and I worked in many different fields in the VA, like OR, ER, neurology, spinal cord, the ICUs. And the one thing that I did see that was a common thread throughout the VA was the lack of education for vets. You're overwhelmed on the floor, as a registered nurse, you're putting fires out, and it's just real hard to make sure that you're getting the education in that patients need. So what happens to a vet that doesn't use your medication or device correctly? What happens is what happens with the veteran's treatment and who gets blamed? Well, the reality is it's not a blame game, but what you want is for the vet to be able to understand their medications and take them properly. And as we get into more complicated oral meds, IVs, sub-Q, and devices, it's even more imperative that the vet understands how to use the product. Myself, I had an example. I had a sinus infection and was placed on a standard nasal spray. Took it for the 2 weeks, went back for my follow-up visit, and talked to the doc, and we were sitting there, and he goes, well, I just don't understand why it's not working. I said, well, my symptoms are still here. So after assessment from him, we decided that, I was taking it wrong. And basically, for my entire nursing career, I was teaching all my patients wrong because nobody taught me how to do that. It wasn't something you really learn in nursing. And so, it could have been avoided with education in the office would have helped that. Another example is a true vet that had a problem with his diabetes. Can you talk about that, Wes? This is Wes Hancock.
Yeah, I'm Wes Hancock, and initially, I have nothing bad to say about the VA, but when you're initially told you have diabetes, it's a lot going through your mind, and you have a lot to process. So when they told me I had to start taking insulin, I was told I could either shoot myself in the arm or the stomach. That's the way I heard it. And doing so, I couldn't reach my arm because I have arthritis really bad. And so I was just doing my stomach, and knots formed in my stomach. And when my clinic nurse at the VA saw the knots, she kind of got on me and said, what are you doing? Aren't you rotating? And I said, well, nobody told me to rotate. And then she explained how to rotate. Well, I had this cellulitis, and I had to be put on a medication, antibiotic to straighten up my issue with the knots in my stomach, which would have been avoided if someone had just set me down and explained to me I needed to rotate and why I needed to rotate. And that's just one example that I can give you, but it caused some problems for me.
So here's an example of how making sure that the patient's educated. And diabetes is a well-known disease, and patients take insulin every day, and not even getting the proper education with that. And then we have these complicated medications and devices coming out, and we want our patients to be compliant. We need to do something about this, and the vets deserve to have the education. Velocity is on the cutting edge of breaking down those barriers between the VA and pharma by taking advantage of partnering with them to educate the vet on complicated medications and devices. It's a win-win situation, really. The VA is slowly, as I'm seeing it, embracing these opportunities to get educators in to educate vets about medications and devices, thus relieving the already overwhelmed VA system caring for our veteran population. It is a win-win for all. The patient will be more compliant, and the provider will be able to manage and a better plan of care and a good quality of life. Companies, though, need to make sure that their educators can get into those and instruct those patients, vets, on medications and devices for better adherence. Educators will explain the signs and symptoms to be aware of in order to provide the provider with information to make the adjustments for their treatment plan. I thank you for watching this, and please let me know what you think in the comments section. Thank you.